Hello physios, I welcome you all to our channel Physio Vidyapit. We are back with our next lecture on ultrasound therapy, okay? And here we are going to study about the contraindications, dangers and the precaution of ultrasound therapy, okay? So first contraindication is rapidly dividing tissue, okay? So there are different conditions in which the tissue is dividing rapidly. So tumor, if there is any kind of tumor, okay, that means that there is the uncontrolled division. वहां पर क्या हो रहा है, डिवीजन, सेल डिवीजन जो है वो बहुत फास्ट रेट पर हो रहा है. एंड इफ वी आर अप्लाइंग अल्ट्रासाउंड which was having the effect on cell membrane, which was increasing the iron, increasing the oxygen, that may further stimulate this tumor formation. So definitely we are not going to apply it. Similarly, it is the same explanation in the pregnant uterus, okay? Whenever the fetus is developing inside the uterus, so here also the cell division is rapid and various anomalies can be seen. In the epiphyseal plate region, cell damage can occur also. According to some researches, burns are also produced, okay? Burns and excessive cell division, okay? That is cell damage, okay? Cell damage is produced, not the cell division, cell damage in the epiphyseal plate region. So we avoid to apply the ultrasound on that region. So next point is the implants. So there are different type of implants. In metallic implants, okay, it can reflect the ultrasound wave. Also the amount of the ultrasound which is absorbed by it can cause the heating, okay, which may lead to the burns, okay. Similarly, in electrical implants such as pacemaker, there also some sort of heating can occur which can damage its functioning. And you know, if the pacemaker is damaged, then definitely it is a very problematic condition. Next is the acrylic bone glue, which is also called joint cement, okay, joint cement. Here also heating reduce, okay, its effect, okay. Heating lead to the loosening of these type of joint cements which are used in the prosthetics, okay. So this was about the implant, okay. So in the first point, the main thing is that the division is stimulated, and here the cell damage can occur and burns can occur. In the second point, which is implant, you can simply write that heating can occur which lead to damage to the electronic implant. Here it can reflect also, and here it can cause loosening of the joint cement, so had a bad effect on the prosthetic joint. Then the specialized tissue such as eyes and gonads. In gonads, it will affect the spermatogenesis because it is a temperature specific process, so it occur at low temperature, and if there is heating, definitely bad effect is seen. In eyes, it can cause retinal damage. As we know, eyes, inside our eye there is a lot of water content which can absorb the ultrasound and reflect it to the retina, where it can cause problem, okay. So retinal damage can occur. In case of infection, if we are applying ultrasound on the part where there is infection, okay, and it can spread definitely, okay. So we are using the same transducer head for other persons also, okay. So it can help to spread the infection, which is not a good thing. Next is radiotherapy. It can stimulate the cancerous cell or malignant cells, okay. Next is vascular problem. In case any kind of bleeding is suspected, we will not apply ultrasound. Why? Because it is a heating modality, okay, and it can definitely increase the bleeding. Whereas in case of DVT, okay, in case of DVT, that is the deep vein thrombosis, it can lead to the rupture of the thrombosis and lead to the formation of embolism, which is more dangerous. Nervous system, okay. Application of the ultrasound on the intact skin on our back, that is good. Okay, so there has been reported no harmful effects of its application. But in case the spinal cord is superficial, for example in case of laminectomy, okay, and in the case of spina bifida where the spinal tissue is superficial, so there some problem can occur, so we will avoid its use on spina bifida and laminectomy. Okay, next is anesthetic areas. Definitely burns can occur, so we will not apply ultrasound here. Next is the dangers. Okay, what are the dangers of ultrasound application? If we are applying and we are not moving the transducer head as required, it may cause burn, it may cause unstable cavitation, which can produce temperature and pressure changes, which can produce a lot of pain and discomfort. Then is overdose, and next is damage to equipment. Yes, if we are not placing the ultrasound head in contact with the skin, that is it is in the air, so the reflection of the ultrasound wave can lead to formation of standing wave, which can damage the piezoelectric crystals. Okay, so these are some dangers, okay, which are very simple. Okay, burn, cavitation, overdose and damage to equipment. Next is precaution. Okay, in fracture, that is in the unstable fracture. Okay, in fracture it was used to diagnose also, but here we use less intensities. Okay, and in breast implants, here also we need to use less intensity. And in case of acute inflammation, here also we need a sort of cooling effect, so we need to focus on the pulse mode rather than the continuous. Along with it, the intensity should be less to reduce the heating effect. Okay, in case of acute inflammation. Okay, so in case of breast implant also, it can cause the loosening of the implant. Okay, so here also we need to give the less intensity of ultrasound. Okay, so this was about the lecture, which is contraindication, danger and precaution. Now let us just summarize it quickly. Okay, so rapidly dividing tissue, ट्यूमर और प्रेग्नेंट यूट्रस में क्या है, पहले ही डिवीजन इतना अच्छा हो रहा है, फास्ट रेट पे हो रहा है, और अगर हमने और अल्ट्रासाउंड दी, सो डेफिनेटली इट विल लीड टू इंक्रीज इन द permeability and increase in the nutrition, so it will promote the tumor formation. And in pregnant uterus, some sort of anomalies can be produced according to some researches. In epiphyseal plates, burns along with the cell damage is seen. Okay, then in implant, electrical implants such as pacemaker, heating lead to the damage of pacemaker. Here also metal implant, it may itself get heated and cause burn. In joint cement, it can cause the loosening. Okay, then specialized tissue, gonads affect the spermatogenesis. In eye, it produce retinal damage. Infection, it is spread. Okay, next is radiotherapy, it can again stimulate the malignant cells. Okay, in vascular problem, in case where the bleeding is suspected, we will not apply it. And in DVT, it can break the DVT and lead to the embolus formation. Nervous system, no contraindication for intact skin, that is intact covering, but in case of laminectomy and spina bifida, we will not apply. Why? Because the spinal tissue is superficial. And anesthetic area, definitely burns can be produced. Then is danger and precautions. Okay, so this was about the 7th lecture on ultrasound. So in our next lecture, we will study about the technique of application of ultrasound, and there will be one more lecture, I think, about ultrasound. Then we will be completing this whole topic. So till then, you keep on studying. Thank you to one and all.